Okay, so let's finish up PowerPoint number 1 in death investigation. And last time we had talked about the two different types of autopsies. So remember, there's a clinical autopsy, which is basically to expand medical knowledge for future people suffering from a certain disease. And then you have a forensic autopsy, where the reason that the person died is maybe not clear. So it's where you need to establish both the cause and the manner of death. So realize, and I'd mentioned this before too, that a death investigation does not always mean that there will be an actual autopsy. But of course, there are situations where an autopsy is absolutely 100% required by law. Okay, and it can vary from state to state. So I'm going to go by what the laws are in Iowa. So any child who dies, who's not, dying of cancer or something that's under a doctor's care, or there's any suspicion at all children have to be autopsied. And a person is technically a child, and if you are 17 years of age and 364 days, and your 18th birthday is tomorrow, you would still be considered a child until you actually turn 18. So every single child death that's suspicious has to have an autopsy by law. Also, any deaths that are transportation related, meaning, so when you hear of like a small plane crashing, it doesn't have to be like a huge airliner. If it's a small plane, that's still a transportation related death. So pilots, if someone who's conducting a train dies, even someone who's driving the CAM bus in Iowa City, if they die while conducting their job, then yes, they have to be autopsied. And realize too that autopsies, it's not simply determining whether the death was natural or unnatural, or whether a crime was committed. Autopsies, and really, a good death investigation system has a very large public health component. So when you hear about, for example, things that have been recalled, like a particular child's toy is a choking hazard, or if you hear about cribs that are defective, or I know a couple years ago there were lots of cases of little kids that were actually getting tangled up in a certain brand of mini blinds and actually, accidentally hanging themselves. All of that is important. So whenever you see like a product recall because it could be deadly, a lot of times that is from autopsy data and from the medical examiner. So it's really finding whether it's unsafe work conditions, whether it's an unsafe product, whether it's a hazard in the environment, or a new strain of a really bad drug or bacteria. It has a very large public health component too. That's not necessarily, crime related. So yeah, all transportation related deaths. Now, this term is one that you maybe haven't heard of, but actually, if you listen to the news, you'll hear this term, quite frequently. So an unattended death just means that someone was by themselves when they died. Okay, so there's no witnesses to that death. They weren't under medical care. We don't know what happened. So yeah, any person who dies and we don't know the reason why. Like I gave the example of the family asking for a wellness check because they haven't heard from their uncle, in a week or so. That would be an unattended death. So unattended does not mean that it's a homicide or that it's an unnatural death. It could be, someone has a seizure during their sleep and they just don't wake up. But if no one lives with them, it's still an unattended death. So, pay attention when you're watching the news in the future. You'll actually hear that term quite a bit. But basically, no one was with them when they died. We don't know what happened. So yeah, absolutely, we need an autopsy on that case. Anything where a person dies at the workplace, while they are doing their job. And that's really to look at, unsafe work hazards. But even, if I'm teaching at Kirkwood face to face, as I did pre-COVID times, and I'm walking down the hall and have an aneurysm, I'm still employed by Kirkwood. I'm dying at the workplace. So I would absolutely have to have an autopsy to determine what happened. Now, ideally, I know the state medical examiners definitely want all suicides to be autopsied. Does that happen in all jurisdictions? Unfortunately, not. So there are local medical examiners, and I'll talk about that system in the next PowerPoint, but that will call something a suicide and not send them for an autopsy. So that's unfortunate, because sometimes something that looks like a suicide could actually be an accident. There's a phenomena called autoerotic asphyxiation, and maybe you've heard of this. It tends to be in males, and it tends to be in younger males, though there have been cases documented of people in their 50s and 60s, and there have been females documented as dying of this as well. But it's basically where I don't know if you'd call it a sexual fetish, but it's basically the person trying to kind of choke themselves or deprive themselves of oxygen while they masturbate, because they believe it's going to heighten their orgasm. And sometimes, when you try to choke yourself, things can go very badly. You kind of reach a point of no return where the person is not able to escape from whatever, choking, whether it's hanging themselves to get that hypoxic effect. But it really is an accident. It's not a true suicide. The person didn't mean to die. It was simply kind of, a sexual experience that they wanted to have. And, unfortunately, there have been documented cases recently in Cedar Rapids where this has happened. And it's really just a tragic accident. It's not a suicide. So all suicides don't have autopsies. If the person's underneath, beneath the age of 18, then yes, they're going to have an autopsy. But does it happen with every suicide? Unfortunately, no. So that's not required. So keep in mind, if it's an unnatural, violent, unexplained death, it has to have a death investigation. But these are the categories where an autopsy is absolutely required by law. And, unfortunately, no one likes to think of their loved one having an autopsy. It's not a pleasant thought. But the family can't refuse an autopsy if it fits into one of these categories. However, I've talked to our state medical examiners about this at the annual medical examiner meeting in Iowa, and they really try to work with the families. Especially if it's a religious or a cultural thing. Like, for example, in the Jewish religion, there are certain, and I'm not an expert on Judaism, but the religion states that the body should be buried within 24 hours. And so the medical examiners, if they can, they work to have that autopsy done and to have all of the tissue samples they need within 24 hours so they can release the body to meet with the family's religious needs. I also know in, I believe, certain Muslim cultures that it's a sin to waste, or not to waste, but to lose any blood from the body. And so at the medical examiner's office, they will actually make sure, normally blood gets rinsed down the drain from the autopsy table, but they will make sure to collect every single drop of blood so it's returned with the body to make, to try to meet the cultural or religious expectations of the family. And I've asked the medical examiners too, it's like, do you get a lot of protests from family members if you can't meet those specific, guidelines? And what they've told me is overwhelmingly people want the answers as to how their loved one died. And if it happens to take longer than normal, then they're usually okay with that, because to them, they just want to know why their loved one died. Okay, so let's see. So one of the other things I think that shows like CSI get incorrect is they would lead you to believe that forensic pathologists are everywhere and they're in every single jurisdiction, and they're basically all over the place. That is absolutely not true. So let's say, for example, you're at Kirkwood and you want to become a forensic pathologist. Okay, so here's what is ahead of you. So let's say you do your 2 years at Kirkwood and then you transfer, let's say to the University of Iowa. Okay, so that's 4 years. Now you have your bachelor's degree. Then you apply to medical school. Okay, and by medical school, I mean either a traditional medical school where you get an MD, which is, like the University of Iowa School of Medicine, or it can be an osteopathic medical school, like Des Moines University. An MD and a DO, which is a doctor of osteopathy, they are exactly the same. They're equivalent degrees. And in fact, if I have a choice between going to an MD or a DO, I actually usually pick the DO, the osteopath, because they're trained also. They do everything that an MD does, but they actually learn about like holistic medicine, like chiropractic and things like that. So they're a little more hands-on. So I actually like going to osteopaths more, but either one of those is considered, a medical school. Okay, so you graduate from there 4 years later. Now let's say you're about 26 years old. Okay, now you do your internship and your residency. So for 4 to 5 years, you are in a pathology residency in clinical and anatomical pathology. Okay, and after that, you are cleared to do clinical autopsies. And then if you want to specialize in forensic pathology, then you do 1 to 2 years of additional training in a forensic pathology fellowship, usually at a large city medical examiner's office, like Cook County in Chicago or Hennepin County up in the Twin Cities. So really, let's see, you're 22, 26, 31. So you're finally able to be a forensic pathologist at age 33. So it's a long path. The other thing is that most forensic pathologists work for state government, so you're not going to get rich. I mean, not that it's, your salary is still going to be good. You're probably going to make over $100,000 a year. That's nothing to sneeze at. But you're not going to make $500,000 like an orthopedic surgeon or, a cardiac surgeon. So you're not going to get rich. So it really, I would describe it as a calling. It has to be a person who's really interested in, helping people resolve, helping loved ones find out why they're, the person that they love died. They have to be a person who's interested in law enforcement. But yeah, I think it's more of a calling. Yeah, because you're not going to get rich that way. And as you'll see in our first video assignment, a lot of times the government gives no funding to medical examiners' offices. So the clinics that they work in are absolutely terrible. So, kind of keep that in mind. Okay, so also, who investigates deaths in the United States? Okay, and this is going to be a good introduction also for the first video assignment that you're going to do. So there are 2 different systems that operate in the United States. Okay, one of them, which in my opinion is not good, is the coroner system. Okay, and the problem is that a coroner does not have to have any medical training, and they are actually simply an elected public official. And however, they are the person that's going to sign off on a death certificate. So they're going to say, oh yes, this was a natural death, and manner of death is natural, doesn't need to be investigated anymore. It could be the town mayor. Often it's the local funeral director, simply because it's convenient, because they have a way to, a place to bring the body. But it could be whoever. As you'll see in the video that you're going to watch, you in a lot of places don't even have to have graduated from high school to serve as a coroner. Okay, so let's say, the coroner is someone's best friend, and whoops-a-daisy, I actually, killed this guy in a drunk driving accident, but I need it to be signed out as an accident. Could you do that for me? And, you know, if you have a coroner that doesn't have good ethics, absolutely, they could do that because they are the one that signs off on all of the death certificate information. So do people routinely get away with murder in parts of the country under a coroner system? Absolutely. Are lots of mistakes made? Absolutely. Okay, so the coroner system is not a good one. The better, okay, here we go. Here's some people who could be coroners. The far better system is a medical examiner system. So a medical examiner has to be a medical doctor. Okay, now look, this is important too. They don't have to be a pathologist. They don't have to be a forensic pathologist, but they have to have an MD or a DO, meaning that they went to either medical school or osteopathic medical school. Okay, so we are very lucky in the state of Iowa to have a complete medical examiner system. So Iowa has 99 counties, and in each one of those counties, there is a county medical examiner who is a doctor. Okay, for example, in Lynn County, our medical examiner is Dr. Donnie Linder, who works at St. Luke's Hospital, and he is a board certified emergency room doctor. Okay, so not a pathologist, but he's taken some extra courses, and so he functions as the county medical examiner. And what I like about Dr. Linder is he doesn't have an ego. Okay, so if he gets information back from his investigators and he is not sure of the cause of manner of death, or he thinks there's just something kind of hinky about the case, he will always forward that body onto our state medical examiners in Des Moines for a full forensic autopsy. Okay, so he doesn't assume anything. So, you know, I really appreciate that about him. And because we have a medical examiner system in Iowa, we literally have no mistakes in terms of assigning cause and manner of death. So it's a really good system. There's a lot of checks and balances. But if you're in a state that has a complete coroner system, can there be problems? Yeah. And I don't want to paint all coroners as being unethical or bad. A lot of them are local officials who step up to do the job because no one else will do it, but they are given no training, they're given no funding. And so, you know, they do their best, but you know, it'd be like me going in to do heart surgery. It's like, okay, I'll watch some YouTube videos and I'll do my best, fingers crossed, but I'm not a heart surgeon. I'm not properly trained and educated, so there's a good chance I'm going to screw up that heart surgery. It's kind of the same things with coroners. And it's simply because the federal government in the United States does nothing to support death investigation. There's no federal funding at all, and so we're kind of stuck with a lot of places having coroner systems. Now, a state can be 100% coroner, a state can be 100% medical examiner, like Iowa, or you can have a mixture of both. Okay, so when I worked in Chicago, we had some counties that were medical examiner, okay, like Cook County, which is right around Chicago. But I remember having to go up to Rockford, Illinois, in Rockford County, and get a sample from a body. It was actually a torso that had been found on the side of the river, and I had to go up there and get a DNA sample from it. So I met with the local coroner, who happened to be the mother of the mayor, and she was literally about 90 years old and weighed, 80 pounds soaking wet. So first of all, she's like, honey, can you help me lift this fella down? He's kind of heavy, because it was a huge man's torso. And she told me, she said, well, no one would step up and do the job, so I wanted to help out my son. So yeah, no training. She was a stay-at-home mom, didn't go to college, and she's the local coroner. Now, really nice gal, invited me over for a piece of pie after we dealt with his torso, which of course I said yes because I love pie, and she was really nice. But no training, a good person doing her best, there's still going to be mistakes made. Okay, so one of the things and why I want you to watch our first video assignment is to really learn about these two systems and how incredibly prone to making mistakes they are. Okay, also in the video, pay attention to the quality of the equipment and kind of what medical examiners' offices look like, because it's ridiculous. If you were going to go in to have surgery in a hospital that looked the same in terms of cleanliness and updated equipment in terms of a typical medical examiner's office, you would run screaming. Okay, it's just awful. Okay, so that kind of gives you an introduction to that. And then we're going to head on to PowerPoint number 2, where we're going to talk about time of death estimates. Okay, thank you.